Hi, welcome to another edition of the Trustcast Show, and I'm really happy to have with us Dr. Sean Saadat, board certified plastic surgeon. He has a kind of an unusual background. Sean knew he wanted to be a plastic surgeon at the age of 8. He skipped a year of high school to enter an accelerated med school track, and then he got his MD at 25. And now he's a Beverly Hills plastic surgeon, highly competitive, a clay sculptor, and he's building Atlas, an AI native medical record system designed to change how doctors work. Okay, let me start off with my opening question. So you're a plastic surgeon who does clay sculpture and graphite drawing. When you're reshaping a nose, are you thinking like a doctor or an artist?
I would say honestly, it's a combination of both, and also to add in there a little bit of a psychologist because it
Okay.
really, I think it really is very artistic in that sense. Ultimately, the way I kind of describe it is I studied art in my undergrad period. I did do a minor in studio art, so I got some of those formal artistic courses. And I think one thing I kind of liken plastic surgery in my mind to is that I am an artist, I am a sculptor, I am a drawer, whatever it is. But the difference between me and a clay sculptor is a clay sculptor has to be an expert at their medium, which is clay, how it dries, how it forms, how it shapes, how it ages. My job is to basically know my medium, which is the human body. And that's essentially where whatever decision I'm making during a rhinoplasty, it has to be artistic for the moment, but it also has to be scientific to think, okay, if I make this maneuver, how's that going to change over time? What's that going to look like, not just in 6 months, but in a year, 2 years? And psychologically, how does this fit the person who I'm operating on, and how does it fit their character, their personality, and their goals? So that's why it's such a, I guess, a very nuanced answer for you there.
So what happened when you were 8 that made you say, "Hey, I'm 8 years old. I want to be a plastic surgeon"?
I know it sounds, every time I say it, I'm like, I sound like a cliche, but ultimately the reason was my mom used to watch on Discovery Health Channel. She would watch a bunch of different shows that were medically oriented, and there was specifically one that was called Plastic Surgery Before and After at the
Hmm.
time. And the story she tells me was that she came in, she was watching that show and then an Operation Smile special. And what happened was I started like kind of curiously asking like what are they doing? And she was like they're changing the way people look, whether they have birth defects or it's for cosmetics and all of that. And I was like and I was already very interested in art in general. And I was like, "Oh, like an artist?" And she's like, "Yeah, that's basically what they are scientifically." And essentially, from that point, that whole summer, I watched plastic surgery before and after every day. It got to a point where I would even ask her to buy me. I had a lot of stuffed animals, and I would ask her to buy me like blue towels. So she bought me like a blue beach towel. She would give me like a sewing kit, some extra cotton fluff, and I would sit there and I would take apart my stuffed animals, sew them back together, try and like cinch their waists, like fix their faces, all these things. So really from that point, it just kind of became part of my identity. And to everybody, including I think myself, surprised that goal never really went anywhere. It just kept escalating.
That's a good little story. So you skipped a
Yeah.
year of high school and got into to get into early admission med school program.
Hmm.
Whose idea was that?
That was my idea. I came home when I was in 11th grade. It was like the first week of school. And I remember I had already mapped it out in my head. I was like, okay, I want to be a plastic surgeon. That means at minimum 14 years after college. And in my head, I was like, I didn't love high school. I had friends, but it wasn't like, I didn't really understand the appeal of like partying and all that in high school. I was like, that's for later. And basically, I looked around in my class and I was like, I can't do this for 2 more years and just waste a senior year of getting just electives. So I started kind of doing the math of like, okay, how many classes would I have to take this year if I wanted to finish at the end of this year? I came home to my parents, told them I was like, I figured it out. If I basically take 8 core classes with one online class, double up on the APs, I can like finish and I can take the SAT in like 3 weeks. My parents thought about it for a while because I was 16 at the time, and they talked to a few people, and to my surprise, they were like, "Okay, if this is what you want to do and you understand how hard it's going to be, we support you." So, I did get a lot of pushback from friends and patient, or sorry, not patients, my friends' parents, even the school itself was like, don't do this. It's very bad for your resume. Because what I didn't realize was a lot of colleges don't like accepting people who've graduated early because usually there's emotional immaturity and a high
Hmm.
dropout rate. But I was gung ho about it, and I was like, I'm going to do this. So I did. I ended up getting into George Mason, and then shortly thereafter applied to a early admission program where I was the one person to get selected from the year to basically not take the MCAT and just go straight into medical school right afterwards. And it allowed me to study abroad instead of taking the MCAT, which was a fair trade-off in my mind.
So yeah, so tell me about the not t so my son is a resident. So tell me
Okay.
about not taking the MCAT because I know he was like studied for I don't know forever,
Forever, I know. And every time I
and
tell
then
my
stress.
colleagues, yeah, when I tell my colleagues I didn't take the MCAT, I usually get a middle finger back. So it's a pretty, it's a pretty contentious exam for people. But what George Washington Med School, they had a program with George Mason and a couple other schools where they would accept one or no people from each school every year. So it was very small and selective. But what the argument was that all this time spent during college, not only do you have to get good grades and do extracurriculars, but then you're spending a whole year's worth of time studying for the MCAT, putting together applications. And in this context, they were like, so what is it that you would do with that time if you were to get in without having to take the MCAT, just having to maintain a certain GPA? What is it you would do with that time? And my response was semester at sea, which is it's a study abroad program where
Hmm.
you get on essentially a cruise ship and go around the world. And I was like, this would be an irreplaceable experience I would have where I would be able to not only see another country, but see 19 countries in the span of 4 months. Really get an experience of seeing the world, seeing different cultures, seeing how things operate, and being able to kind of compare them to each other in a short period of time and kind of really establish that worldly vision, which I think is important for any healthcare practitioner, because especially in the US, you're just surrounded by many different ethnicities. If there is an ethnicity, we probably have them in the US, and the cultures vary. So I think in the practice of medicine, it's important. Now, I will say I did obviously push for it, and it was a good trade-off for me at the end of the day, but they bought into it, and I do think it definitely made me a better doctor in the long run.
Oh, that's fabulous. So you had your MD from George Washington by 25. What did your friends think of you at that age? I mean, you
I think,
probably had a lot of pride in I mean, I'd be bragging on my son. I think.
yeah, no, definitely. I would say a lot of pride, a lot of support. My friends and my family have always been very crucial in helping me in this process. I think in general, I had always built this. I mean, as an 8-year-old, I'm sitting there saying I want to be a plastic surgeon. I'd already kind of built this hyper ambitious, like, this person is not going to give up until they get what they want, even if that means going to the moon. Uh, so definitely, I think I did have a positive influence on like my family members who are younger than me, but the support has always been awesome between my friends and family and everybody. And as much as they've been wowed by it, they have also seen me at low points and high points and all of it in between. So it's been really a journey.
So, were you always a kid drawing and sculpting, or did the art kind of come later?
No, that was always part of it. It was not just drawing and sculpting. Actually, a lot of performance art was like a really big passion of mine, and that was like doing plays, doing improv. I loved being on camera or on stage. Just any kind of artistic expression has always been really powerful for me. And I played piano. Like up growing up, I still play it. I produce music now. So it's like a really good pastime for me and a very passionate thing. And it's a great outlet for me, honestly.
That's one of those things when I was a kid, I was kind of pushed towards piano and I just pushed back. And now as an adult, I wish I wouldn't have pushed back. I wish I could sit down in front of a piano and play. So I'm envious of people like you.
Yeah.
So you were in Operation Smile Club in med school. What did working with, kids or people with cleft palates shape how you think about cosmetic work?
So I'll be honest. So the Operation Smile Club, I started it in college actually, and the reason for that was I was kind of there wasn't one, and I was just kind of curious how this system works. You kind of always hear about cleft palates and Operation Smile, so I built the club. We really focused mostly on like fundraising at the time. So we
Hmm.
did like a date auction, we did, different, we did like a bake sale. So we would do fundraising where I didn't really get much direct exposure to any patients. But when it came to medical school and residency, that was where I started really seeing a lot of reconstructive work, cleft palates included. We would work at Children's Hospital Los Angeles, which is one of the largest cleft centers in the country. Um, I think what was interesting to me just about the whole world of plastic surgery was that even as somebody who was like, I want to do this from the age of 8, I was shocked to find out how little I knew about what the breadth of plastic surgery was, even when I started. And I think, seeing cleft palates, one thing that's really unique about the cleft palate experience is that surgeons who do cleft palate operations, they get kind of this continuity of care with patients that a lot of times you don't get in other aspects of plastic surgery because you are establishing a relationship with those patients from when they're 2 months old and or sometimes even before they're born, and you're getting to know the parents, you're operating on them, you're taking care of them for 18 years, sometimes 20 to 25 years afterwards. So I think that was the part that was really fascinating to me. It also did kind of point out, it made me wonder because I know there's been a lot of ethical questions about how Operation Smile worked at one point because it sounded nice to go and correct cleft palates for kids. But I think one thing that's really important for the public to know, and that I've kind of realized over my practicing period, is that with cleft palates, it's not just about the surgery. It's so much about the relationship that you establish and the follow-up that those people have with their provider. And I think a lot of that I've taken into my own practice, even though it's mostly cosmetic with some reconstructive work at the hospital. It's really all about how plastic surgery is not just a technical job. It's not just about doing the surgery. It's about kind of guiding emotionally, whether it's a nose job or a leg reconstruction or a cleft palate, holding their hand, being there for them, because you're really guiding people on a journey that is very scary. Surgery is no joke, no matter what it is. So I think that's where the cleft palate experience really gave me that sense of like, oh, this is emotional. This isn't just purely surgical.
So you finished your residency at UCLA in 2023,
Mhm.
and then you opened in Beverly Hills. What's it like competing against surgeons who, I mean, that's the place where probably the most competitive place in the United States. I mean, to be there in Beverly Hills. What's that like competing against those really?
Yeah, the big players. It's not, I will be completely straight up. It's not for the faint of heart. I think it's not even as much that the other players are malicious or anything like that, but at the end of the day, like you said, you're competing with them, and they have 20 years of a media brand built out. I think the reaction to me wanting to do that right off the bat, it did remind me a lot of like when I said I want to graduate high school early, when I said I want to do all these things where people are like, you're crazy. Like that's not what people typically do. But for me, it was a challenge. And personally, I don't love working for large systems. And we'll kind of get to this with the AI stuff, but a lot of my career already has been kind of figuring out the tension between my love of practicing medicine versus my disdain for the systems that run the current practice of medicine because of the way they're formatted. So to me, it really made sense. Go out there, put yourself out there. Yes, you'll struggle for a couple years. It's gonna be painful, but the payoff at the end of the day will be much, much bigger. And I'm okay with sitting with that discomfort. But I will say, yeah, it's at the end of the day, like I think one reason why my practice has done well thus far is because of media presence, because I push myself on media constantly. I'm posting 5 educational Instagram videos a week for 2 years. I'm doing a lot of outreach, but it requires that. If you expect to just open a shop in Beverly Hills and have patients flow in, it's not going to happen. There are patients, but they're just going to have a hard time finding you. And that's really, I think, the biggest thing is just being visible.
So yeah, there was a study, or there was an NIH study actually. It was published in NIH, and it said that if you, so I saw you do some video, that
Mhm.
if you use video you're 40, you get people who use video are 47%, get 47% more consults than people who don't. I mean,
Yeah.
it's remarkable. I mean, the difference. So kudos, hats off to you. So
Oh, thank you.
what you call your approach Eterna Beauty. So what does that mean to you?
So I know it's like one of those like kind of catchphrases that a lot of beauty practitioners use, but Eternal Beauty, the reason I kind of landed on that name was because my general philosophy with beauty is obviously that it's subjective. I really don't like the idea that there is like a cookie cutter beauty standard for everybody. You know, what might look good for you is not going to look good for the same person or for the next person. And that's where that artistic side really comes in. And I think eternal beauty kind of points to like the eternal nature of beauty. Like it's not just about always looking like you're 27 or always looking like you're 33, even when you're 65, 75. I think my practice and my vision is much more about when you come in as a 65-year-old, yes, I look at your photos from the past because that tells me how your face has aged or how your body has changed. And it gives me a general viewpoint of where should things land. So, you know, if you had a nose that looked a certain way, I'm not going to drastically change it unless that's part of our plan. But at the end of the day, that's where the Eternal Beauty method comes in. It's more about looking at the person, not just in that moment of time, not just what they want in that moment of time, but looking at them throughout the process of their life, how their faces have aged. What has their experience been? Do they work a job that they've been in the sun all the time, or have they been good with sun protection? What is their home life like? You know, are they getting surgery for themselves or because their husband wants them to have larger breasts? You know, it's like it's really more so about taking that global approach with patients and like the eternal nature of beauty, how it just leaks through everything, and how beauty, the quest for beauty, I've said this many times, is with the human species, you can look back to even the earliest civilizations, and there is evidence of self-enhancement, whether it's through makeup use, through body modifications. People are always trying to use their bodies to speak for them without actually saying anything. And I think that is where I just see beauty as this kind of eternal, it's an eternal quest for human beings in general, you know?
So you've authored 18 publications, and which one changed how you actually operate, or did any of them change how you actually operate?
There is actually one that really did change how I operate. I did co-author a publication that was kind of a case study, but we were able to figure out basically breast implants when they're put in. They're a silicone shell around them and usually have silicone gel within them. Now, over the course of 10 to 15 years, those implants can rupture, and that's a real nightmare for surgeons because, as you can imagine, a wall forms off in the body around that implant. But when it
Hmm.
ruptures, now all of a sudden you're left with a pocket full of a bunch of silicone goo. And the hardest thing is, I don't know if you've ever felt free silicone or touched any free silicone. It is sticky. It attaches to everything. It's like oil. And I was able to actually figure out that a very basic antibiotic called clindamycin acts almost like a surfactant, where it kind of like washes that, it breaks down the bond between the surface and the silicone rather than
Wow.
having to like deal with the messiness. So I did that in my chief resident year at UCLA. And now anytime I have a ruptured implant case, I always use that antibiotic as a wash, and it works beautifully. So that one has definitely been the most practical, I would say.
So you also did you illustrated a diagram for a U.S. I'm not a shill, by the way. These I come
Oh
up
no.
with on my own. I did not get these from Dr. Sean.
Yeah,
So
I love it.
your research, or you illustrated a diagram for a U.S. congressional hearing on Medicare coverage of eyelid surgery. How does a plastic surgery resident end up end up drawing for Congress? How did that
So
happen?
that was actually one of the best ways that helped me get into UCLA. I think if anybody's been through the medical school and just application process to residency, as your son knows, I'm sure, it's all about, you know, at the end of the day, you're looking at applicants who are all the top of their class. They all have a million extracurriculars. They all have research. So how do you differentiate yourself? And this was, I would say, this was really pivotal in me realizing how my artistic skill could help with plastic surgery publications and helping me to like differentiate myself. So when I was doing a rotation at UCLA to kind of audition for residency, I ended up getting connected with Dr. Robert Goldberg, who's a very prominent oculoplastics surgeon. He's ophthalmology. And he saw some of my drawings, and I asked him, I was like, is there any role for me to do illustrations? Because I do very lifelike graphic illustrations. And he said, he was like, yeah, actually, I am looking for an illustrator because I'm giving a presentation to Congress, essentially where these two conditions of extra eyelid skin versus actual sagging of the eyelid itself were all being bundled into one condition when it came to Medicare reimbursements. So he was like, I just need a very simplistic illustration, but like high quality, showing what the real difference, there's a big difference between hanging skin versus an actual low lid. So I did that drawing for him, gave it to him. He presented it to Congress. And then, from my understanding, it sounds like they actually were able to get the changes through to the law to not bundle those two things together. So that was
here's my here's my commentary, side commentary. Why the hell is Congress involved in something so it doesn't seem like a law kind of thing. It seems like more of an administrative kind of thing. It sounds crazy.
Yeah, and like I said, that was a big reason why I've been pushed into the AI space is because just seeing things like this, I'm like, why are lawmakers who maybe two of them have a medical or science related degree of the 535 of them, like why are they the ones making this choice if I have to so basically explain to them what the difference between these two conditions are? But I think it says a lot about our health system right now and why it is pretty broken in a lot of ways because we do have people who don't really know what's going on making these decisions ultimately.
Yeah. So, okay, rapid fire questions. These are more like fun questions.
Sure.
Clay sculpture or graphite drawing?
I would say graphite drawing.
Best nose job you've ever done without naming a name, obviously.
Yeah, of course. No, I would say there was one nose job that I will never forget. It was a patient who had had a silicone implant placed in the Philippines 10 years prior to like basically augment the nose, but it had messed up a lot, and just had a lot of inflammation. So I went in, I took the implant out, and I was able to basically reconstruct her nose from the ground up because she had nothing usable in there, using rib cartilage from a cadaver, since she didn't have rib to give. And I've seen her most recently 3 years after surgery, and her nose looks totally natural, really nice, as if nothing ever happened. So I thought that one was a really just kind of cool rhinoplasty all around.
Yeah, that is a cool story. Worst trend in plastic surgery right now?
I think the worst trend in plastic surgery, if we're talking about surgical procedures, I would say that in general, the overdone look, kind of like the seeking of the Instagram, TikTok filter style look, is really not great. And especially on young people when they're doing it in their like 20s, like mid 20s, they're getting facelifts and stuff because they want to look more like the filter that Instagram puts on them. Because I'm like, that's going to age poorly. And then I would say the worst trend I see on the plastic surgeon side of things is a lot of the marketing, I feel like, has become a little stale. It's very copycat style. When one surgeon posts a type of video, 50 other surgeons just mimic them. It's very unserious. I think we just need a little bit more educational stuff out there, just figuring out how to make that entertaining. But to me, that's where I think plastic surgery has to make a shift, where in the public persona, it's less about the Dr. 90210s and more about what the field actually is.
One tool you can't operate without.
I would say in surgery or in general.
I don't know. It's an open-ended question.
Yeah, I guess in general, I would say AI. I mean, I will say ChatGPT and Claude have been massively helpful in helping me to organize my business, decrease operation burden. I even use them as a method of like a preoperative sparring, where I will kind of describe, obviously don't put like patient information in, but I'll describe like, okay, I have a 38-year-old female wants a rhinoplasty. This is my plan. This is my approach. And then I'll say like cross-reference that with what the medical data is out there, what research studies there are. Tell me if anything I'm doing is outdated. If you think there's anything that I could, try out in this case, then I will kind of sit back and forth and use it almost like a resident where I'm kind of getting questioned, but also forcing myself to teach what I'm saying. So that way it just maximizes the preparation prior to surgery.
Almost like a Socratic kind of
Exactly.
learning method. Okay. So what's on your operating room playlist?
Oh, number one is a lot of Dua Lipa. I love Dua Lipa. It's a lot of dance music, a lot of high energy music, my own music too. I have like a stage name for my music, which is called Sistema. I make a lot of like electronic, I produce tracks. So a lot of that, but it's a lot of like very dancey, upbeat music. Just because I'm like, we're already working hard. I like to focus and have fun at the same time and just really be in my groove. So that's really the majority of my playlist.
Persian food you can't live without.
Oh, that's a good one. There's something called tadig, which is the crispy rice. It's basically like the bottom of the pan. When you make it, you make this like crispy rice layer. When done right, that is perfection. And I could never live without that long term. Sometimes I'll make a full pot of rice just to have the crispy part. But yeah, that's my favorite.
I'm with you there. I love paella, and
Yeah.
it has a lot of that crispy rice in it. It's one of my favorite things. So what's Atlas, and why is a plastic surgeon building an electronic medical record system? It just doesn't it doesn't go together.
I know.
It's like
I know.
rice and oranges.
Yeah. No, I know you would think. But I will
But
say
there must be some reason why that you got frustrated with something
yeah.
that started the process.
Yeah, I think a big part of it started right upon the time I left residency. And during residency, there is just this the administrative overload of residents now is so immense. Most of your time you're not spending doing clinical work. You're not spending in the operating room. Most of your time is spent doing notes, scheduling, organization, prior authorization work, whatever it like, trying to figure out billing. And there was a falsehood that I was kind of expecting, and I think a lot of residents do, is that when you graduate, oh, that's the job of the resident. But that's only true if you have residents at an academic facility. And even then, right upon starting my practice, I started seeing how much the system in healthcare, under the guise of like compliance or privacy or whatever else they want to use as their descriptor, they just constantly put roadblocks for physicians left and right, whether it's through licensing, whether it's through payment portals, authorizations with insurance, getting contracted with insurance. And then I started looking more into the EMRs because I had to get a medical record system for my office. So I actually went through 2 or 3 different ones. All of them I noticed were just basically, two sides of the same coin. They were designed in such a way that sure, they had fancy features, but the data was so fragmented. Everything that they would claim would make it easier for doctors just resulted in more clicks and under some very shiny, fancy user interface. So then I started really looking into, well, what is the problem here? And at that point, I started noticing the basic of medical infrastructure, of medical records infrastructure, is an infrastructure that was actually designed in the 90s, around the time when Epic, which is the largest player in the medical
I knew
record.
they are. Well, I
Yeah,
was in the
they.
medical device business, so
Oh,
yeah,
okay. So yeah. And
years
basically
ago.
the one thing I'll say with Epic is it really is. It's a messy, I always liken it to basically a warehouse full of filing cabinets that have millions of documents. It's messy and it is structured exactly that way. And then so I started looking into AI and basically thinking, well, why can't AI organize this? Like if AI can access all these files through ChatGPT, through Claude, through Gemini, whatever it is, why can't it do the same for healthcare? And that was when at that point I realized that it's not really an option for these large player companies because their infrastructure is so outdated. The only way that they could even consider moving to a truly AI assisted system would be by demolishing their modern infrastructure and starting from the ground up. Because the data, the structure they have is not intended for ingestion by AI and by these LLMs. So at that point, I was like, okay, well, this sounds like the only real option is for me to just start creating my own and see what happens. So I did file a provisional patent on my idea, basically kind of putting together the entire architecture. I spent about a year learning data architecture, LLM infrastructure. I did do actually some research with LLM and data management in residency. And so at that point, I was like, okay, I think as crazy as this idea sounds, I'm just going to start pursuing it. I started learning some coding. I've put together like demos. I actually have a CRM that intakes leads now in my own practice, and it qualifies them by texting them, kind of making sure they're real numbers, and then letting us know an update of who's real, who you should reach out to. Um, and that was at that point I really started to see that fragmented AI tools are not the answer. Whereas a lot of people are like, oh, there's ChatGPT Health for patients. They can run their own documents through. Oh, there's this AI add-on for your note taking that you can connect maybe to your EMR. But all of that just adds more and more apps. And I think as physicians, the one thing I've heard by talking to all my colleagues, people in the community, we are sick of the fragmented system that makes it so easy to miss things. And I think I looked at other practices and I was like, these private practices are not run efficiently. They have so many employees that are not doing much when they're working. No one really knows what's going on. It's just a very messy system. And the problem is the doctor's so busy, they usually don't have time to sit and worry too much about business management. So then essentially the idea has come together. Now I'm kind of starting to put together a team to start really building this thing out, hopefully piloting it in practices within this year. But yeah, that's really why it kind of, rather than just from the plastic surgery angle, it came from more so the business of medicine angle, where I was able to see firsthand the pain points and also see that those who are developing tools most of the time are not clinical. And I think that's where I was like, well, if someone's going to do it, I love AI, I love medicine, I love business, might as well synthesize all those together and then see what I can do and hopefully change things, whether it's for 10 practices or all practices, we'll see.
So I think that's a good attitude, whether it's for 10 practices or all practices, because
Yeah.
it seems like you start somewhere, and just the idea of getting your foot in the door at a couple places, then that's you're on your way.
Yeah.
So how far, do you have any other practices that are using that list yet, or is it just you that is you're kind of kludging things together to get to the place point where you can get somebody else to try it out for you?
Yeah, and that's where I've been at now because I think one thing that's very different about healthcare software development is that we are burdened with more regulatory compliance statutes than any
Hmm.
other industry, and it makes sense. At the end of the day, patient privacy is very critical. But that's been the challenge is like I can do it in my practice, but for me to do it for somebody else, we're talking about like a BAA liability wise. So that's where I'm making sure that the security infrastructure gets really, really well ironed out. We have a senior developer who will do all of that. That's where I'm saying like putting together the team, and that's kind of what I've
Yep.
been looking for over the last year, just to find the right people. But that's where once that aspect is there, then the piloting will start, and then hopefully, the rest
So
will snowball.
I wonder if you operate on a different calendar. Maybe you have a 27-hour day. So I mean, between you got the software thing going on, you're really into AI, you like your art, you post on Instagram, you post on Facebook, and then you throw in a few surgeries here and there, um,
Hmm.
other marketing. How do you find the time?
My sister always says that the only thing I'm not good at is rest. So I'm very passionate and I'm very good at multitasking too, and I do have a really good team for my practice. So my practice is well managed by my practice manager and my ads team and social team. When it comes to doing like social media, I think the common denominator between everything you listed is they're all things I enjoy. Um, and that gives me energy. Now, do I have days where I'm like, I don't want to do anything? Absolutely. That is, I'm a human being and I will fully admit that. But yeah, I think I get energy from doing these projects, and often it happens in bursts. where like for a 2 week period, I won't sleep that much because I'm just so excited working on 15 different things, and then it'll slow down, and then, so it's a lot. It's not like I said, it's not for the faint of heart, but it's, my passion, I think, is really what drives me at the end of the day.
So what's advisorus? Did I pronounce that
So
right?
which one is
Advisorus?
advisorus? Uh-huh.
Advisaurus.
I'm not sure. I
Maybe
haven't heard
my
of that.
research broke down. My
What was it? What was
research
it in relating
was
to?
something to do with the business of beauty. So this is obviously my research assistant did not
Yeah.
missed on that one. Okay.
I know
How much?
sometimes I will say sometimes there's things on like Google and around there that I'm like, I have never heard of that, but my name is on page. Sometimes they do that.
Well, you're trying to dive deep in to make sure that you're really covering.
Yeah.
Um, you're listed at Perk Plastic Surgery on LinkedIn, but also run Dr. Sean Plastic Surgery. What's the relationship there between?
Perk.
Yeah,
I haven't heard of that
on
one either.
on LinkedIn. Okay, I'm going to cut that out
Yeah.
of this little
Okay.
out of this podcast so that it doesn't get confusing.
Sure.
How much of running a Beverly Hills plastic surgery practice is medicine versus marketing?
I will say starting out, it's 90% marketing, 10% medicine, just because you don't have enough patients to practice that much medicine. I think I would say honestly, it comes down to 50-50 because even your patient interactions is a form of marketing, as long as, because so much of the business is relevant to word of mouth, One thing I've noticed is a lot of people are word of mouth referrals, but it is my social media that they were given my name by somebody. Then they sit and they'll watch my social media videos for 3 months before reaching out. So it really is this kind of like very intertwined marketing strategy you have to have. I always say it's like everything everywhere all at once. Like you really just got to flood the zone so your name is visible and also in ways that you want it to be. You have to be thoughtful about that, not just pouring a bunch of crap out there for people to ingest, but like truly being intentional. And I think especially at the beginning of the practice, it's really about getting saturated in media, which takes time. But at the end of the day, yeah, a lot of it is marketing every time you're out and about. If no matter where I'm at, the second someone finds out I'm a plastic surgeon, somebody will inevitably start telling me about some body part that bothers them and how they've been thinking about. So it's always about presenting yourself well, kind of, being aware that even when you're not at work, you're still representing your brand and really kind of getting comfortable with what your brand is. And I think that's why it's so important to have an authentic brand because it's a lot harder to keep it up all the time if it's not really you.
So is this right? You still volunteer as a clinical professor at UCLA?
I do, yes.
How much time
Yeah.
does that take?
It's not much. It's
Okay.
very sparingly. It's like once every few months.
Okay.
I started like an aesthetic journal club when I was a resident for cosmetic surgery. That was once a month, and I would put that together. And then I've been really happy, actually, the residents since I left, they've continued that going. So oftentimes I'll go to that once a month with the residents, do discussion, teaching. Occasionally, maybe once a year, a couple times a year, I will assist in the operating room, like kind of help chief residents do cosmetic cases. But all of that is relatively new, so I'll be doing more of it, but it's not by any means a demanding time commitment.
So here's the most important question. Where can people find you, book a consultation, or follow the Atlas journey?
Yeah, so as far as consultation, you can always go to my website at drshawnplasticsurgery.com. Just submit on there. You can also contact us through any of the social media platforms like Instagram or TikTok. And then as far as Atlas goes, I have started a Substack page, which is at Dr. Sean, and also on LinkedIn, I will post usually twice a week articles kind of relating not just specifically to Atlas, but kind of highlighting the problems, discussing what's going on in healthcare, updating people on healthcare news, and then bringing that into how AI can help. But there will be any announcement about Atlas's progression will be usually on LinkedIn. And that's where, yeah, basically across all the platforms, I would say YouTube too is a big place where I kind of merge both topics and do weekly long form videos as well as daily short form. So there's plenty of places you can find me on.
Okay, that's terrific. Well, thanks a lot, Sean. I really appreciate you being on. That was really great.
Yeah,
And
thank
hang on
you.
with me for a second. Let me press the stop button here and we can get this all uploaded.